Hello everyone. Welcome to my live program today. A warm welcome to my viewers on LinkedIn, Facebook, Instagram as well as YouTube. Today I am going to speak on one very interesting topic, and that is how lymphocyte immunization therapy works. I am Dr. Mohan Raut. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers in Mumbai, Pune, Nagpur, Delhi, Bangalore, and Hyderabad. And at these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using lymphocyte immunization therapy and other immunomodulatory treatments. An important thing here I want to share with you is the lymphocyte immunization therapy that we do at our centers is patented and is branded as ImmuLIT. Now, why I chose this topic is because many times our doctor friends and as well as patients ask us, Doctor, does this therapy really work? And if it works, then how does it work? So today I'm going to discuss in detail about how lymphocyte immunization therapy works. Now let's come to the basics of lymphocyte immunization therapy. As the name suggests, lymphocyte immunization therapy is use of lymphocytes to induce immunomodulation. It's a type of immunotherapy. Now, to understand how lymphocyte immunization therapy works, we should know a little bit about the immunology of pregnancy, because pregnancy plays a very important role in maintaining immune system plays a very important role in maintaining normal pregnancy. And there is immunological balance, the inflammatory and anti-inflammatory balance, or Th1 Th2 balance, which maintains the pregnancy. And any disturbance in this balance will lead to abnormalities of immune system, which will affect pregnancy adversely, leading to either miscarriages or implantation failure, leading to IVF failures or even unexplained infertility. So if investigations indicate that a couple has immunological factor or what is called as alloimmune factor as the underlying cause for these reproductive failures, then these couples are selected for lymphocyte immunization therapy treatment. Now, one more aspect about immune system I would like to stress here is when we treat these couples with immunological treatments, there are distinct two types of treatments. One is called as active immunomodulation and the other is called as passive immunomodulation. Active immunomodulation is that type of immunomodulation where we use a treatment to act on the immune system of the patient. Then the immune system is stimulated, which produces antibodies and cells which protect the pregnancy. While in passive immunomodulation, there are certain passive immunomodulatory medicines which prevent the immune attack on pregnancy. Now, lymphocyte immunization therapy or ImmuLIT is an active type of immunomodulatory treatment. Now, what is exactly done in lymphocyte immunization therapy? Now, as I mentioned, it uses lymphocytes. Whose lymphocytes? Lymphocytes from husband or any donor who is tested for infection can be used to induce the effect of lymphocyte immunization therapy. The way lymphocyte immunization therapy is done at our centers, it is a 3-hour one-time process, and basically it involves collection of blood from husband, separation of lymphocytes and injecting these cells into the skin. And subsequently, these cells are responsible for the immunomodulatory effect. So let's come to the main part of today's talk. How does lymphocyte immunization therapy work? Now, as I mentioned, in these patients, there is already an immunological problem. That is, the protection of pregnancy is not adequate or it is very poor because of the lack of protective antibodies which protect the pregnancy or lack of protective cells called T regulatory cells which protect the pregnancy. So in presence of low or no blocking antibodies or low T regulatory cells, immunomodulatory treatment becomes essential and becomes useful. So what does LIT do? Now, when we inject these cells into the wife's skin, what happens there is these cells are taken up by what are called as dendritic cells, which are present in the skin. Now, the function of these cells is to pick up the lymphocytes and take it to the immune system of the mother, and to be specific, the secondary or immunological organs like the lymph node or the spleen, where they are presented to the immune system and to the T cells and B cells of the immune system. Now, what happens there is, because of certain antigens which are present on the lymphocytes. See, on the surface of lymphocyte, there is a marker or antigen called as CD200. And this is very important for the immunomodulatory action of lymphocyte. So when the lymphocytes are fresh, this marker remains alive, or it is functional, or it has its immunomodulatory effect. If these cells are collected from blood that is stored, then these cells lose their CD200 marker, and these cells lose their immunomodulatory action. So very important fact to remember. So these fresh cells, when they are injected into skin, the CD200 goes to the maternal immune system, and it stimulates the maternal B cells and T cells. Now, what happens there is, these B cells are potential cells which produce the antibodies, while the T cells are the cells which will produce the T cells, or the T regulatory cells, which are important later on. So sensitization of B cells will produce the asymmetric or blocking antibodies, while sensitization of T cells will produce T regulatory cells. Now, immune system is very unique. So it has the function of what is called as immune memory. So when these cells are stimulated, these stimulated cells remain in the maternal immune system, and whenever the maternal immune system is exposed to the same antigen again, these cells proliferate, and B cells produce the antibodies, and T cells produce the Treg cells. So now these sensitized cells are present in the mother's immune system. So whenever the patient conceives, if there is a natural pregnancy, or if there is an embryo transfer in IVF, the lining of the embryo cells also has this CD200 marker. So this stimulates these already stimulated cells, and they undergo proliferation and produce a lot of B cells and lot of T cells. And these cells, B cells, produce a large number of antibodies, the blocking antibodies or asymmetric antibodies, while the T cells produce T regulatory cells. And these antibodies and cells now start the protective function for the pregnancy. Now, coming to the antibodies, as I mentioned, these antibodies are also called as asymmetric antibodies or blocking antibodies. Now, why they are called asymmetric antibodies is, you know that any antibody which has a Y-shaped structure, which has two short arms. So these arms are important, they have important function. One arm helps to attach to the substrate at the receptor, while the other arm, when it attaches, it leads to the action. So a normal antibody which is destructive in nature, that is the antibody which otherwise by default destroys any foreign substance, has both the arms, while this asymmetric antibody or the blocking antibody has only one arm. The other arm of the Y is not there. So what happens is, this asymmetric antibody preferentially attaches to the pregnancy, while because there is no second arm, it cannot trigger the complement response in the mother, which prevents the destruction of pregnancy. If these protective antibodies are not there, then by default, the regular destructive antibodies will come and join the pregnancy, attach to the pregnancy at the receptor. The other arm will induce the immune response, leading to destructive function, destruction of pregnancy. So therefore, these blocking antibodies, when they are generated in large number, as happens after the LIT treatment, they help in protecting pregnancy. At the same time, the stimulation of T cells will lead to increased level of T regulatory cells, and they play a very crucial role in protecting pregnancy from the destructive cellular activity, for example, the CD8 type of destructive cells. So, friends, lymphocyte immunization therapy is not an empirical treatment or not an experimental treatment. It has a scientific basis, and this is how it acts to prevent the destruction of pregnancy, the protective antibodies as well as the T regulatory cells. So, therefore, while selecting the couples who will be benefited by lymphocyte immunization therapy, also we use this fact, and those couples who don't have these blocking antibodies or those who have very low T regulatory cells are the patients who will be benefited by lymphocyte immunization therapy. At our centers or in India, we uh, have the test to find out whether these blocking antibodies are there or not, and accordingly we can select the couple. A patient who has high levels of blocking antibodies or which is detected by a test called as lymphocyte cross match. So if the levels are high, the cross match is positive, lymphocyte immunization therapy will have no role. But if it is negative, lymphocyte immunization therapy will be useful because it induces these protective antibodies in the mother's blood. There are studies now which have shown that after lymphocyte immunization therapy, not only the blocking antibodies increase, but also the T regulatory cell count becomes high, which helps in protecting the pregnancy. So, friends, lymphocyte immunization therapy acts dually on on both the parts of immune system, the humoral part as well as the cell mediated part, and therefore it mimics the condition of a natural pregnancy. It creates a condition environment as happens in the case of a normal pregnancy or normal protection of pregnancy. Therefore, the immunomodulatory effect or the protective effect of lymphocyte immunization therapy is long lasting, it is more effective compared to the passive immunomodulation, and also it is safe because, as I said, it mimics the natural protection. Lymphocyte immunization therapy doesn't suppress the immunity, it will cause only immunomodulation. So these are the mechanisms which help in protecting pregnancy through lymphocyte immunization therapy. Now, if you have any questions about this, you can contact us on 9833201522, and we will answer your questions instantly or as early as possible. Please suggest us more topics to discuss on this live program, and we will definitely cover them in our live sessions every Friday evening. So thank you very much for listening to this live. And before closing my talk, I will again say in conclusion that lymphocyte immunization therapy is an active immunomodulatory treatment. It induces protective antibodies called blocking antibodies and protective cells called T regulatory cells, which help in protecting the pregnancy. And the protective antibodies are also called as asymmetric antibodies, which competitively inhibit the regular antibodies to prevent destruction of pregnancy, while T regulatory cells suppress the activity of other cytotoxic cells like the CD8 type of cells, thus effectively protecting pregnancy. Thank you very much.